Hello, and thank you so much for joining me today. My name is Melissa Devine with the Area Agency on Aging 1B and the Medicare Medicaid Assistance Program. Today, we're going to walk through how to choose a Part D prescription drug plan. Today, we're going to discuss who MAP is, what we do, an understanding of Medicare, and Medicare Part D. What is it? What does it cover? The different coverage phases and restrictions, how and when to enroll. Michigan's Medicare Medicaid Assistance Program is comprised of unbiased counselors located across Michigan, offering free health benefit counseling assistance. A MAP counselor can help you understand new healthcare options, help you understand Medicare and Medicaid, help you compare or enroll in Medicare prescription drug coverage, help you review Medicare supplemental insurance needs, help you understand Medicare health plans, help you apply for Medicaid or a Medicare savings program, and help you identify and report Medicare and Medicaid fraud and scams. Now, let's get a better understanding of Medicare. So what's Medicare? Medicare is health insurance for three groups of people: those that are 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease. It is administered through the Centers for Medicare and Medicaid Services, also referred to as CMS, but enrollments take place through the Social Security Administration for most and the Railroad Retirement Board for railroad retirees. Medicare has well-defined benefits and exclusions. Typically, Original Medicare does not cover dental, hearing, or vision except under special circumstances. It does not cover long-term custodial care, and it places limits on certain care items such as physical therapy, durable medical equipment, and more. It also does not cover over-the-counter medications. Medicare does work with private insurance companies to provide Part D prescription drug coverage, supplemental or Medigap plans to help fill in the gaps in Original Medicare, and Medicare Advantage plans, which combine parts of Original Medicare, usually with prescription drug coverage and often dental, vision, and hearing coverage. Now, there are four parts of Medicare. In Original Medicare, you have Parts A, which is your hospital insurance, Part B, which is your medical insurance, and Part D, your Medicare prescription drug coverage. You also have the option of Part C, which is a Medicare Advantage plan. It functions much like an HMO or a PPO, and it typically rolls your Part A, your Part B, and your Part D together into one plan. When you first enroll in Medicare, you have two ways of receiving your Medicare coverage. The first option is to go with Original Medicare, which includes your Medicare Part A hospital insurance and your Medicare Part B medical insurance. You then can add a Medicare Part D plan for prescription drug coverage, and you can also add a Medigap policy or a Medicare supplemental insurance policy to help pay those out-of-pocket costs in Original Medicare. The second route is to take a Medicare Advantage plan, often referred to as Part C. These plans are like HMOs or PPOs and typically include Part A, hospital insurance, Part B, medical insurance, and Part D, prescription drug coverage, all in one plan. In Original Medicare, Part A hospital insurance will cover hospital care, skilled nursing facility care after a 3 full-day admission in the hospital, home health care if medically necessary, and hospice care if medically necessary. Medicare Part B, your medical insurance, covers your doctor visits to your primary care physician and specialists, outpatient hospital services, clinical lab testing, and preventative services. Enrolling in Medicare may be automatic for those receiving Social Security benefits in either form, retirement or disability, and Railroad Retirement Board benefits. Those who are receiving such benefits will receive their initial enrollment period package mailed out 3 months before they turn 65 or 3 months before the 25th month of disability benefits. If your enrollment into Medicare is not automatic because you're not receiving Social Security benefits or railroad retirement benefits, perhaps you're still actively working. You can enroll into Medicare with Social Security's office. You can give them a call at their 800 number, apply online at Social Security's website, ssa.gov, or, if available, visit a local office. If you're retired from the railroad, you can enroll through the Railroad Retirement Board by calling them at your local Railroad Retirement Board office. You don't have to be retired to enroll in Medicare. Your initial enrollment period lasts 7 months. It begins 3 months before you turn 65. It includes the month you turn 65 and ends 3 months after you turn 65. And there may be other times that you want to enroll. But please note that if you delay your enrollment into Medicare, you may be subjected to pay a penalty when you choose to enroll later on. Now let's learn a little bit more about the Medicare Part D prescription drug coverage. What is Medicare's Part D? The Medicare prescription drug benefit, also known as Part D, provides prescription drug coverage to Medicare beneficiaries. This benefit is only available through private insurance companies that contract with Medicare. Part D is offered either as a standalone plan for those enrolled in Original Medicare or as a set of benefits included with your Medicare Advantage plan. When choosing a Part D plan, it's important to understand what it covers, how much it costs, and how you can find the right plan and enroll. Medicare Part D covers outpatient prescription drugs. Each Part D plan has its own formulary, which is a list of drugs the plan covers. The law requires all Part D plan formularies to include at least 2 drugs in most categories or classes, and substantially all drugs in the following 6 classes: immunosuppressants, which are used to prevent an individual's body from rejecting an organ after a transplant; antidepressants, which are used to treat depression; antipsychotics, which are used to treat schizophrenia and bipolar disorder; anticonvulsants, which are used to treat epileptic seizures; antiretrovirals, which are used to treat HIV and AIDS; anti-neoplastics, which are used to prevent the development of tumors. Some drugs are excluded from Medicare coverage by law and cannot be covered by any Part D plan. These include drugs used to treat anorexia, weight loss, or weight gain. However, Part D may cover drugs used to treat physical wasting caused by AIDS, cancer, and other diseases. Other medications excluded from Medicare Part D include fertility drugs, drugs used for cosmetic purposes or hair growth, drugs that are only used to treat cough or cold symptoms, drugs used to treat erectile dysfunction, drugs that have not been approved by the Food and Drug Administration, drugs prescribed for uses other than those approved by the FDA, prescription vitamins and minerals except for prenatal vitamins and fluoride preparations, and most over-the-counter drugs. One of the biggest questions we get is, does Part D cover vaccines? Yes, Part D plans must include all commercially available vaccines on their formularies, such as the shingles vaccine. The Part D plan pays for the vaccination itself and for your doctor or other healthcare provider to give you the shot. Exceptions are immunizations for flu, pneumonia, hepatitis B, and some other immunizations that you may need if you're exposed to a dangerous disease or virus, such as tetanus, are covered under Part B. With the COVID-19 vaccine also covered under Medicare, it'll be under Medicare Part B. There are a number of costs associated with your Part D plan. You may have a monthly premium, an annual deductible, and coinsurance amounts or copayments for your covered drugs. A premium is the amount that you're going to pay monthly to have coverage. An annual deductible is an amount that you will potentially have to pay out of pocket before your plan begins to cover your prescription drugs. Please note that not all Part D plans do have a deductible. A coinsurance or copayment is the amount that you're going to pay out of pocket for your covered drugs. A coinsurance amount is a percentage of the cost of the drug. So if your plan charges a 15% coinsurance for covered generic drugs, that means that you're going to pay 15% of the cost of that drug. A copayment is a set amount, such as a $20 copay for a covered generic drug. Many Part D plans use tiers to price the drugs listed on their formularies. Typically, drugs in lower tiers are less expensive, and drugs in higher tiers are more expensive. When selecting a Part D plan, it's important to consider how much you will be paying each month for your drugs. This includes noting if your drugs are in lower or higher tiers on the plan's formulary and what their copayment or coinsurance charge will be. Coverage restrictions, also known as utilization management tools, come with rules that you have to follow before your plan will cover your drugs. There are 3 main types of coverage restrictions: prior authorization, step therapy, and quantity limits. Prior authorization means that you must get approval from your Part D plan before the plan will pay for the drug. Your provider is often part of this process and can provide the documentation needed to prove that the medication is medically necessary. Step therapy means that your plan requires you to try a different, less expensive version of the drug before it will cover the more expensive one. And quantity limits restrict the amount or the quantity of a drug that you can get per prescription fill, such as 30 pills of drug X per month. Throughout the year, you may notice that you're paying different amounts for your drugs. This is because Medicare Part D plans have coverage phases, during which you will pay different amounts for your covered prescription drugs. These coverage phases are the deductible phase. If your plan has a deductible, you start off the year in the deductible phase. During this time, you're going to pay out of pocket for the entire cost of your drugs. Then you have the initial coverage period. After you've met your deductible, if you had one, you move on to the initial coverage period. During this time, you and your plan share the cost of your prescription drugs, and you'll pay the plan's copays or coinsurance amounts at the pharmacy. There's then the coverage gap. After your total drug costs have reached a certain amount, you enter the coverage gap, which was formerly known as the donut hole. This amount combines your copays or coinsurance amounts with the amount that your plan has paid for drugs. This is important to note that low pharmacy copays do not necessarily mean you won't reach the coverage gap. When you enter the coverage gap, you'll be responsible for 25% of the cost of your drugs. Catastrophic coverage. The last coverage phase is catastrophic coverage. Once you've met the true out-of-pocket for the year, you will move out of the coverage gap and into the catastrophic coverage. This amount includes your deductible, copays, or coinsurance amounts that you paid during the initial coverage period, and almost the full cost of the brand name drugs, including manufacturer discounts, that were purchased during the coverage gap. Any amount paid by your plan does not count to get you into the catastrophic coverage. Your monthly premium and the cost of your non-covered drugs also do not count. During the catastrophic coverage, you will pay 5% of the cost for each of your drugs. Your plan should be keeping track of how much money you have spent out of pocket on your covered prescription drugs and which coverage period you're in. This information should be printed on your monthly statements, also known as an EOB, or explanation of benefits. There are many things to consider before choosing a Part D plan. Depending on your needs, your financial situation, and your preferences, some of the following questions and guidelines may be more important to you than others. Like, does this plan cover my meds? If you take a lot of prescription drugs, then choosing a plan that has your drugs on its formulary is an important first step. If the plan does not cover your drugs in its formulary, then you may end up paying out of pocket for the entire cost of that drug. You should create a list of the names of prescriptions that you take, their dosages, and whether they are brand name or generic. This can help you sort through plans and choose the ones that cover your drugs. You should also find out if there are any restrictions on your covered drugs, such as a prior authorization, step therapy, or quantity limits. A MAP counselor can help you do so by contacting the plan or looking at the plan details in Medicare's Plan Finder tool. It is important to note that these are important because they may affect your access to drugs at the pharmacy and may require you to speak to your doctor. You are also going to want to know, what are the costs associated with this plan? If you choose a plan with a deductible, know that you'll have to pay that amount out of pocket before your plan begins to cover your prescription drugs. Some people prefer to have a deductible if it means their monthly premium is lower, while others prefer to pay a higher monthly premium instead of paying out of pocket to meet the deductible. You should also think about the most you can and want to spend on the drugs plan monthly premium. Other things to consider would be whether your pharmacy is considered preferred or non-preferred, in-network or out-of-network. Many drug plans include both preferred and non-preferred pharmacies in their network. You typically pay less for your drugs at a preferred pharmacy than at a non-preferred pharmacy. And if you go to a pharmacy that's close to your home or easy for you to get to, it may be beneficial to look for a plan that categorizes that pharmacy as a preferred in-network pharmacy. Some plans have a mail order option that may have cheaper prices than your local pharmacy. If you prefer mail order, you can look for a plan that includes that option. If you prefer to pick your drugs up at the pharmacy, be aware that if your plan has a mail order option, that it may affect your coverage in any way, like you may need to opt out of the mail order option before you can start picking up your drugs at the pharmacy. You might also want to consider the plan star rating. Medicare uses a star rating system to measure how well Part D plans perform in different categories, including quality of care and customer service. Ratings range from 1 to 5 stars, with 1 being the lowest and 5 being the highest. Medicare reviews plan performance each year and releases new star ratings each fall. Star ratings are not the only factor that you should consider when looking for a plan. Even though a plan has a high star rating, it may not be right for you if it does not cover the drugs that you need. However, star ratings can be a factor to consider once you find the plans that will provide the best coverage for you. While Part D is technically optional, if you don't sign up for Part D, you may end up with a late enrollment penalty when you enroll later on. However, you can delay your Part D without incurring a penalty if you have currently creditable drug coverage. Creditable drug coverage is coverage that has an overall value that's as good as or better than your standard coverage under Part D. You may receive creditable coverage from a current employer insurance policy, retiree insurance, military benefits, or federal health benefits. If your drug coverage is creditable, you'll receive notice from the plan around September of each year. If you do not receive this notice, you should contact your benefits manager to get this information in writing. Keep these notices, as you will need proof of your creditable coverage if you decide later that you want to enroll in Medicare Part D. If you lose your creditable coverage, for example, maybe you were covered by an employer plan and you decide to retire. You then have 60 days after losing that creditable coverage to enroll into a Part D plan without a late enrollment penalty. If you're thinking of signing up for Part D plans in addition to your current drug coverage, you should ask your employer or retirement benefit administrator if you can keep their coverage and have Part D at the same time. You could lose your employer, retiree, or other benefits if you sign up for a Part D plan. It's important to keep this in mind if your plan covers a spouse or dependents, because if you lose coverage, they will too, and it's unlikely that you'll be able to get that coverage back. You can join a Medicare prescription drug plan when you first become eligible for Medicare. An example, during your initial enrollment period. Typically, that begins 3 months before you turn 65. It stays the month you turn 65 and for up to 3 months after you turn 65. After you enroll in a Medicare prescription drug plan, you typically remain with that plan for the rest of the calendar year. You can also enroll into a Medicare Part D plan during the annual open enrollment period, which is October 15th through December 7th each year. If you had Part D coverage already, you can also change your Medicare prescription Part D plan during the annual open enrollment period in the fall. There are also times throughout the year that one can disenroll or get a special enrollment period. Most of those are a bit lengthy to address in this presentation, but it can include low-income individuals, those who have an involuntary loss of creditable coverage, moving outside of the plan service area, and more. All of which is covered in the Medicare and You book and can be provided to you by a MAP counselor. We can help you contact the plan to enroll by calling, visiting Medicare.gov's website with you, or even visiting the plan's website with you. If you're covered by credible drug coverage, then you can delay your enrollment into Medicare Part D without penalty and utilize a Part D special enrollment period to enroll in Part D later on. If you remember, credible drug coverage is on average as good as or better than the basic Part D benefits. If you have drug coverage through an employer plan, you should receive a notice from your employer or plan around September of each year, informing you if your drug coverage is creditable or not. If you've not received this notice, contact your Human Resources Department or drug plan benefit manager. Please be aware that this information may come as a separate piece of mail and it can be included with other materials such as a plan newsletter. But the several types of plans that offer credible drug coverage include VA benefits, TRICARE for Life, federal employee health benefits, and some job-based and retiree plans. If you have one of the above forms of coverage and they have not provided you with written proof of credible coverage, again, request this notice from your benefits administrator. If you're considering delaying enrollment into Part D because you already have the prescription drug coverage, make sure to find out if the coverage is considered creditable. Maintaining enrollment in credible drug coverage means that you will not incur a late enrollment penalty for delaying in Part D, and that you can utilize the special enrollment period, which is a 2-month special enrollment period after losing that credible coverage to enroll into a Part D plan. Again, remember, if you decide to delay enrollment into any part of Medicare, keep a record for your insurance until you enroll into Medicare. You may need the documentation in order to sign up for Medicare later. For each month that you delay enrollment in Medicare Part D, you have to pay a Part D late enrollment penalty unless you have creditable coverage, meaning that coverage is just as good as or better than the basic Part D benefits. You qualify for the Extra Help program, or you prove that you received inadequate information about whether your drug coverage was creditable or not. In most cases, you'll have to pay the penalty every month for as long as you have Medicare. If you're enrolled in Medicare because of disability and currently pay a premium penalty, once you turn 65, you'll no longer have to pay that penalty. But in most situations, you must pay the Part D late enrollment penalty as long as you're enrolled in Medicare prescription drug benefits. There are some exceptions to the rule. Again, if you receive extra help, your penalty will be permanently erased. If you're under 65 and have Medicare, your late enrollment penalty will end when you turn 65. If you were to qualify for state pharmaceutical assistance programs, it may pay your penalty for you. But if your Part D plan determines that you have had a break in creditable drug coverage for more than 63 days, you may have a late enrollment penalty. If your plan has reason to believe that you've had a break in that coverage for more than 63 days, they should contact you to ask you to provide a verbal or written statement of creditable drug coverage. This statement is called an attestation. If you do not attest to the plan that you had creditable drug coverage, your plan should mail you written notification that you have a late enrollment penalty. A late enrollment penalty reconsideration notice and a late enrollment penalty reconsideration request form. Late enrollment penalty reconsideration notice explains your rights to request a reconsideration of your late enrollment penalty. Everyone has a right to appeal their late enrollment penalty. A late enrollment penalty reconsideration request form is used as the form to appeal the late enrollment penalty with Maximus. That's the company contracted by Medicare to handle the appeals. Maximus is the company contracted by Medicare to handle the appeals. You can appeal the penalty if you think that you were continuously covered, or its amount if you think that it was calculated incorrectly. You should complete the LEP reconsideration request form and any evidence that you have and mail everything to Maximus. A MAP counselor can assist you further with this issue and even provide you the address to Maximus. So let's say you delayed enrollment in Part D for 7 months and you do not meet any of the exceptions that were listed in the previous slide. Your monthly premium would be higher by the amount that is 7% of the national base premium for as long as you continue to have Part D. The national base premium for 2021 is $33.06 a month. So your monthly premium penalty would therefore be $2.31 per month because you're taking $33.06 and you're multiplying it by 7%, which is $2.31, which you would pay in addition to your plan's premium. The Part D penalty is always calculated using the national base beneficiary premium, and your penalty will not decrease if you enroll in Part D with a lower premium or increase if you enroll in a Part D with a higher monthly premium. And it will change each year as the Part D beneficiary premium changes each year. If you have a higher income, you may have to pay more for your Medicare drug coverage as well. If your income is above the certain threshold limit, $88,000 for a single individual or $176,000 for a joint return, you may pay more for your monthly plan premium. This is what we call IRMA. It's the extra amount in addition to your monthly premium that you pay. It is calculated based off of your IRS tax returns from 2 years prior. So if you have a change in circumstance, you may want to file an appeal. If your income and assets are below a certain level, you may qualify for extra help. This is also known as the low-income subsidy. It's a federal assistance program that helps pay for prescription drug costs, how much you pay for your prescription drugs, and the monthly premium, depending on whether you have full or partial extra help. If you qualified for extra help in 2020, you likely qualified to continue it in 2022. Now, if you're receiving a plan that is within the LIS plan maximum, it will help pay for your Part D monthly premium. If you do not already have Part D, enrolling into extra help will automatically enroll you into a Part D plan. It'll also help you avoid the late enrollment penalty. For other assistance, for those with limited income and resources, you can look into Medicaid, drug manufacturer pharmaceutical assistance programs, and potentially even comparing prices to see if coupons like GoodRx would work better for you. MAP's here to help. So if you'd like to speak with a counselor about your specific situation, just give us a call. Our number is 1-800-803-7174. We're currently counseling over the phone and through Zoom, but our services are confidential and unbiased, and no question is too trivial. We often deal with the very complicated questions as well. And with Medicare's open enrollment just around the corner, give us a call to schedule your open enrollment period appointment today. We have counselors at the ready to provide you Medicare open enrollment period counseling. For more information, there is help available. You can look at Medicare.gov's website, the Medicare New Handbook, give 1-800-MEDICARE a call, or again, reach out to MAP. Our number is 800-803-7174. Navigating that maze of Medicare can be tricky, but we at MAP are here to help. Thank you so much for joining me today. If you have any questions or would like to speak with a MAP counselor, give us a call. We look forward to assisting you further.